Welcome to the WisTransPortal Crash Data Retrieval Facility Training. My name is Andrea Bill. I am the Safety Program Manager at the UW-Madison Traffic Operations and Safety Laboratory. My email address is at the bottom of the screen. So at any point, if you have any questions about this data or this training, go ahead and send me an email and I can follow up. The overview of this course is while this course was done in person at 3 different locations around the state in 2019, we also wanted to provide this online training available to you. Portion of the training is lecture-based, and then you'll have opportunities to get on WisTransPortal itself and be able to look at it. The objective here is to learn more about the crash data, the tools, and more specifically about WisTransPortal Crash Data Retrieval Facility. The training is intended for new and returning WisTransPortal users. The outline of this training, it will be broken up into several of video clips. So you can either use the playlist and play through all of it, or you can take the individual videos as they come and kind of go back to. So we're going to start with safety in Wisconsin crash statistics. Well, we want to be thinking about transportation. It is the safe and efficient movement of people and goods. The big question that we get a lot of the times is how do we define safe or safety? You might get this question a lot of the times that says that my intersection is unsafe, or what are the top 10 issues or intersections that are unsafe, or where is safe locations. But really you want to get down to the question of what is safe or what is safety. Is it a freedom from danger? Is it a state of being certain that adverse effects will not cause by some agent under undefined conditions? Is it the reciprocal of safety is risk? Over time, our ideas on perspective of safety have changed. In the beginning, we were kind of a fatalistic, this is God's will. Then we moved into more of this kind of legal perspective where we had tort or liability. And then more recently in the past couple decades, we've been moving more to this scientific, what is safety? And we really think about the forces that act upon the driver or the passengers inside that vehicle or that pedestrian. So we think about why is safety so important. Over on our roadways, on the U.S. roadways in 2016, there was over 7 million police reported traffic crashes, 37,000 people were killed, and then 3 million people were injured. And what we have to think about here is, what can we be doing? Why are we doing this? Is this going down? Is it staying the same? How do we affect this? And then looking at the crash data, it's really important to be able to know this to figure out what's happening and also understanding the biases of what's happening within the traffic crash data. In Wisconsin in 2016, we had about 130,000 police reported traffic crashes. This is what I'll be calling the DT4000s in future slides. We had 524 people who were killed and over 31,000 people that were injured. As you can see over time, our kind of crashes have been going up and things have been kind of changing and maybe staying a little bit the same. In 2019, traffic crashes are going back down again, but again, we want to be thinking about what can we do to have a sustained deceleration or decline in our crashes and our fatalities. So why do crashes happen, and what are the efforts to prevent those crashes? We can think about this in several different ways, but as we think about what are the causes of crashes, one study that was done, and it's been cited a lot of times, is that the human error factors are the biggest factor in 93% of the crashes that happen. When we break up crashes into either roadway, driver, or vehicle, you can see in this Venn diagram that you can see that the drivers constitute the largest component of that. And what we have to think about, though, is while we cannot prevent stupid, are there things that we can do to help minimize that human error? If we think about this through what's called the hat-on matrix, which was developed in 1980, we can break our contributing factors into a couple different informations. So you can think about this from the pre-crash standpoint, during the crash, and post-crash. And then you can break it up into the human factors, the vehicle and equipment issues, the physical environment or the roadway or traffic-way environment, and either socioeconomic or kind of the policy side behind it a little bit. And as we're thinking about what can we do to help improve the safety of our roadways, we want to be thinking not just at the crash and at the physical environment standpoint, but we want to be thinking about this in a holistic standpoint. Are there things that we can be doing to help prevent that kind of the mistake that happens in that pre-crash? And are there things that we can even do to help once a crash has happened to minimize the consequences of that by making sure they get to the proper trauma centers or hospitals as quickly as possible? One thing we want to think about is this Towards Zero Deaths. It's a national strategy on highway safety. It was developed in 2014. In Wisconsin, we have zero in Wisconsin. This Towards Zero Deaths is a national goal. It is a highway system free of fatalities through a sustained and even accelerated decline in transportation-related deaths and injuries. What we think about here in Wisconsin is that zero in Wisconsin is a zero preventable deaths on Wisconsin roadways. So really thinking about what can we do here in Wisconsin to make sure that our preventable deaths are zero. And we want to think about how we can do this from all areas of what we do in kind of more of a holistic approach. What we have for the Transportation Reauthorization Bill, this MAP 21, it was signed in 2012. It stands for the Moving Ahead for Progress in the 21st Century. It has a performance-based contribute to it. And then one thing that happened with it is it required states to report serious injuries as well as fatalities. Prior to MAP 21, all states had to report their fatal injuries. As we move forward and understanding that when we think about fatals and serious injuries, that could just be the difference of EMS or trauma center locations. What we really want to think about is how do we, if we really want to get to those Towards Zero Deaths, we have to start looking at the serious injuries as well to find those trends. So to do that, it required states to report serious injuries and making sure that we had the same definition of serious injuries. And we'll talk a little bit more about that as we move forward. As we think about kind of safety, there's two different things you can think about. You can think about a hazard and you can think about a risk. Sometimes we use those words as interchangeable, but we want to think about that in terms of safety science. There's kind of two different distinctions. Hazard is a condition which could result in a casualty, either injury or death. And then risk is the likelihood and consequences of a hazard. So the two pictures I show below, the bottom left one there is a woman carrying a candle. So it is a low hazard because she's probably not going to have a very large injury or death from that candle, but a high risk because it's an open flame near, it looks like a baby, it's near that, and so then the consequence or the likelihood of that happening is pretty large in examining it. The other one is a tiger in a cage. So think about that if you were in the cage, that this pent-up tiger, you would probably have a large hazard or a high hazard of having an injury or death from being in it. But it is a low risk because we do have that cage. It's surrounding that tiger. So we're in kind of the likelihood of being mauled by that tiger is low when you think about that. So when you think about this is what I would think about is when we're examining our roadways, we want to be able to think about it in a risk structure. What is the likelihood of something occurring and then the potential consequence. So when we're thinking about our network screening or examining our infrastructure and examining our crash locations, we want to be focusing on kind of that top right-hand side of things where there is a almost certain that expected to occur regularly under normal conditions. So these are just everyday driving or expected to occur at some point in time, but having that could be probably pretty likely that likelihood could happen. And then also that the potential consequences is high. So injuries or illness requiring hospital admissions, injuries or illness resulting in permanent impairment or a fatality. So that's kind of thinking about how we are going to examine that. We want to be thinking about this risk matrix. This risk matrix isn't just new to transportation safety. It's been around for a lot of times. This is used a lot with occupational safety and health, process safety engineering, and other types of engineering fields out there. As we think about how we examine crashes and when we think about those contributing factors to it, in the past we've kind of been thinking about the traditional 3 E's. And when we think about these 3 E's, it's usually every road safety problem can be solved by applying the 3 E's. And we think about those as engineering, education, and enforcement. Over time, we've added some other E's to it that I think are important as well too. So emergency medical services, evaluation, example, encouragement, everyone else that kind of goes along with it. This was developed around 1915 and it was promoted by the auto industry. It works best for issues that involve a relatively small number of agencies and stakeholders. What we kind of see at this point in time as we look at crashes, it's very easy to kind of point fingers across the table. It says it's not my issue, it's somebody else's issue. So when we find that it can be difficult to apply to problems that cut across professional disciplines or agency boundaries. An example of this is maybe a location that you have out there where it's on a curve and that 9 cars that have run off and hit a tree there have been impaired drivers. And you also have one person that ran off the road and hit that wasn't an impaired driver. And it's very easy to say, well, this crash can't be fixed, or this location can't be fixed because it's an impaired driving issue. But really, when you dive a little bit deeper into it, you can see that both the impaired drivers, which was 90% of them, and the other driver hit a tree that caused kind of the larger injuries, caused that sustained force to that body that caused that injury, was because of the tree. And so you could remove that tree. You're not necessarily addressing the impairment issue, but you're addressing what's causing the injury to those drivers. And so you want to be thinking about this kind of on a larger component to it. Another example of this is a single vehicle run off the road crash involving fatigued drivers. So when we think about this from an engineering perspective, it's kind of hard to isolate it to a specific location because it's involving fatigued drivers. Roadway reconstructions are very expensive to examine. Enforcement, it's hard to figure out where that targeted enforcement can happen. Fatigued drivers can happen kind of anywhere, and examining that. And education, public outreach effectiveness can be limited. So if we think about the 3 E's and just try to tackle it within each individual silo, we're not going to get at this problem. So we need to be thinking about things in a little bit different fashion, and we need to be thinking about things in more of a holistic component to it. That moves us to towards a safe systems approach. The safe systems approach breaks things into vehicles, roads and roadsides, road users, and speeds. So if we think back to that single vehicle run off the road crash involving fatigued drivers, instead of thinking about those individual silos, if we start to think about it from a systems approach, what can be done? So we think about that, from a vehicle standpoint, there are new technologies that are out there to help keep with lane management and lane deviation, so it might beep at you. There are even cars out there now that monitor your micro steering and your movement on your steering, on your gas pedal, your acceleration and deceleration, and it might beep at you after a little bit to tell you to go get a coffee break. So we can think about from a vehicle standpoint, we're trying to improve that. From the road and roadsides, we're trying to think about our rumble strips to help alert drivers to keep them on the roadway, making sure that our clear zones, and we're keeping everything out of that roadway so that if you do run off that roadway, you're not going to hit a tree or cause sustained damage right away. For our speeds, we're trying to make sure we manage our speeds, and we'll talk more about the kind of this big component to it. We want to make sure we manage the speeds that are not going to create extra force on that body. And from the road users, it's always a big component of it, is they need to understand what their factor is and how does fatigue driving affect their driving capabilities just as much as impaired driving. So we've been doing some more research on that. So they're really thinking about this in more of a holistic standpoint versus kind of those individual silos. The elements of the safe system, the idea here is if one element of the system fails, the other elements help minimize the consequences of this failure. So you can think about this as a nice cherry pie, that if you take a little bit of slice out of that cherry pie, that cherry filling kind of oozes in and fills up that pie dish a little bit. And the idea is the same here, is that we know things are going to happen. We know that individual pieces of that pie might be cut out, but we want to make sure that those other elements help minimize the consequences of that failure. So we're not preventing all crashes. We're trying to prevent the ones that have serious injury and fatalities associated with them. This was developed in 2008 by safety experts from 21 countries. The U.S. was represented by our federal partners, the National Highway Traffic Safety Administration, Federal Highway, and the Federal Motor Carrier Safety Administration. They did a rigorous analysis of factors that cause crashes. So they looked and say, what are the crash causations for it? And then what were the causations of the injuries, and kind of looking at it and breaking it down into these 4 components. It was grounded in that work by Dr. William Haddon, the first NHTSA director, similar to what we saw with that Haddon matrix in just a few slides previously. The principles here are pretty basic. I think everybody who's listening to this presentation understands this. Human bodies don't withstand crash forces well. Instead of trying to eliminate all crashes, we want to focus on preventing death and serious injuries from the crashes. And although some crashes involve an element of misbehavior, many are due to a simple mistake such as a momentary inattention. So we want to make sure that if you make a mistake, you don't lose your life. And if we think about kind of how the human body is built and kind of how we do withstand crash forces, the human body can withstand crashes better front to back than it can side to side. So if we think about our largest severity of crashes, and we think about those intersection crashes, which we call T-bone crashes or right angle crashes, those are the ones that are usually the most severe because the brain can't handle the G-forces from the side as much we can't handle it very well anyways, but the human brain and body can withstand crash forces better front to back. So that's why rear end crashes are usually not as severe as the right angle crashes, but with anything with force, the speed plays a huge factor in it. We want to make sure we're strengthening all parts of the system and examining what we can do at our parts. And then system designers and system users must share responsibility for managing crash forces to a level that doesn't result in death or serious injury. So if we think about what we're doing from a design standpoint now, we are improving our guardrails. We're making sure we have our crash attenuators out there around our bridge piers. We're trying to make sure our clear zones and everything else so that if a vehicle does run off the roadway, it's slowing it down. So we've done a lot from the system designer standpoint. But we have to make sure that the system users as well, so these are the drivers, the pedestrians, the bicyclists, the bus riders, all of those things understand that they must share responsibility for managing their crash forces as well. And so this gets to seatbelt usage, examining the speeding of the vehicles, and kind of how all that plays together a little bit. There's a state in the southern part of the United States that does something when you get your driver's license. They also have you sign a quote-unquote contract to understand that as you get your driver's license, you have a responsibility for knowing what happens when you don't wear your seatbelt. So understanding that you can cause injury to yourself, but you can also cause injury to people inside the vehicles by creating a moving object inside that vehicle, and understanding the consequences of driving impaired and over the speed limit and distracted. So again, this trying to make this as a holistic approach to say that we can all play a factor in making sure our roads are as safe as possible. So making the roadway a safe system. So the thinking about here is that traffic crashes usually involve a chain of events. It's not just one thing that goes wrong, it's several different things that goes wrong with it. The primary goal is to break the chain before a mistake turns into a serious incident. So that, if just one thing happens, that it just comes out with maybe a property damage only crash or a minor injury crash. Fallback goal is to reduce the incident and injury severity. So if we think about here we have the collision, we have our energy transfer, and then we think about what, depending on how much that energy transfer is, it'll depend on whether it's an injury, severe injury, or death. And we want to think about, how does our police and other things that happen along with it to make sure that our system is as safe as possible. And even going into our incident management is there so that we don't have secondary crashes or collisions with the police and fire as well.